Hi, hope you're having a great day. My name is Nishtha from beyourawesome.in and I'm joined today with Dr. Vasudha Sharma. We are going to be discussing specifically male infertility in today's conversation. There's been a lot of discussion about what women face, so we thought we'll give the men some attention here. Dear doctor, thank you very much for joining us and sharing your knowledge with us.
Thank you.
Let me introduce Dr. Vasudha Sharma to you. Dr. Vasudha Sharma is the Director of Medical Services of Vivekanada Health Global, an international chain of integrative medicine headquartered in Bangalore. She is an entrepreneur in the field of integrative medicine, an Ayurveda and yoga therapy consultant, researcher, and an international speaker with 21 years of clinical experience. Dr. Vasudha Sharma has been a clinical practitioner integrating Ayurveda, yoga, and acupuncture, and her area of specialization includes integrative pain management and women health, including infertility. So we welcome Dr. Vasudha Sharma.
Thank you for having me over, Nishtha. And I think male infertility should be an interesting topic as well. I hope you'll get more viewers watching, male viewers.
Sure. And if you've not watched the previous few series, part 3 and 4, please go ahead and watch them now. Here are the links. So let's start with, what are the common issues that you're seeing today with male infertility?
So when a couple comes down for help, generally, the male comes with problems such as reduced semen count or, inadequate semen count, no semen count at all. And you also see problems such as reduced motility of the sperm and erectile dysfunctions, maybe premature ejaculation. These are some of the common problems which we are acquainted. It's interesting to understand that there is a science in Ayurveda, a branch in Ayurveda which specifically talks about aphrodisiacs, which is called Vajikarana. So a lot of understanding of treating people, especially male, with certain issues comes with this background as well, and we can manage these conditions quite well. It's just that people need to be aware that sciences like Ayurveda do offer treatments for these problems.
Right. And what are the common causes of these problems that you see in your practice?
Common causes in urban areas, I think stress will be on top, because
for sure.
Yes, and stress leads to, once again, the endocrine imbalance, leading to problems such as oligospermia, which is reduced semen count, or motility issues, and a lot more. And otherwise, you have sleep, deficit in sleep disorders, which can also lead to problems. Then you have other substance abuse in men, alcohol, smoking, which are definite triggers for problems like this. Obesity is another major issue, especially abdominal obesity, which is there in males, very common, especially in India.
Right.
So I would put these as some of them, but there are some of them which are not very commonly known but are problems as well. The kind of clothing which men may wear, this can also impact their sperm counts. And if in ancient days they were saying, wear a langot.
Yes.
There is something behind that.
Science.
Yes, there is a science behind that. So you should preferably not tighten the scrotal area and allow good temperature regulation there. It should not be like heated up, so then that causes a lot of problem. And Ayurveda very nicely says that the sperm is actually cool in its nature. So if you bring in more heat, then it disturbs the health of the sperm.
Right.
So I think a lot of such things which have very well been described.
Right.
So men need to take care of small but very important things, large but also very important things.
True. And what are those things? Let's throw some light on those things in our next section.
Yes. See, like I said, small things, the way they dress to where they sit. So I think that is something which we should address. Say software professionals, they're sitting for like 8 hours, 10 hours.
Right.
And then if their clothing is not very comfortable, or if they're in the office, obviously they'll not go there
or
with
if they're
shorts.
sitting with the laptop on the lap.
Yes.
Right.
So, now work from home, okay, they might sit with the shorts there, but they cannot go to workplace like that.
True.
So, the clothing to the postures, everything is important.
Right.
And the inner wear is also important. So, have some understanding that these have all been made, for human requirements. So we should not just get carried away just with fashion. So fashion is what suits you, and you shouldn't just imbibe things. And when they sit for longer duration, they should also take care of their spine health, which is important. And even to have good reproductive health and sexual health, it is very important to keep your spine health good. And then of course, the long-standing job adds on to stress. So managing stress with respect to changes in their lifestyle, bringing in simple tips, like doing some breathing exercises, maybe every 2 hours. No, not that you sit and make everybody feel you're doing something, but it can be as simple as just do some
deep breath
taking, in your seat. And if you're really stressed, that your eyes are also showing up, come on, please close me. So don't wait.
Right.
So instead, you can do simple things, just rub your palms, keep them on your eyes, and you can just close your eyes. And also, so there are so many small little things which people can do to handle stress. But understand that your body is feeling stressed. That's where people go wrong.
Yeah. First identify that there is a problem and then address the problem.
Yeah, the body throws signals, but you as an individual, for some reason, are not able to capture those signals.
Right.
But if you have something bigger, then you would go to a doctor saying, I'm facing XYZ problems. Then the doctor would say, you're lot stressed. I think stress is your major problem.
And that is unexplained infertility. It's not clinically yet there, but your body is already telling you that, there is things that you need to address.
Yeah, this is one of the reasons why infertility can come in. Though your picture shows normal, your semen count is good, a lot of other parameters are good, but still no answer. The same with your partner. The lady is fine, all her scan is good, her hormones are good, but still they don't know why.
True.
Yeah. So in such a condition, balancing with your diet, lifestyle, bringing in that mind, body, spirit, balance is very, very important.
And that's where the natural methods are extremely powerful, because they're not only going to solve your fertility, they are going to solve everything for you.
Correct.
So
yes, because don't look at it as a physical constraint. Look at it in a perspective that how did this get transformed, to being a physical problem. The mind is an essential component there. And therefore, Ayurveda, yoga, all of them stress a lot on keeping your mind under balance as well.
Awesome. So this is great information for what men should do for themselves. And then there is also the partner who's going to go through the whole physical changes. So there's one question that I want to ask you. What is the one thing, according to you, that men should do to help their partners when they're going through this whole journey of conception?
Yes. So two ways, in which I would like to answer. One, in which the male has a problem, the female also has a problem. Then the male probably is a little subdued. I also have, you also have, come on, let us attend to it together. This is more so the scenario looks at balance, but in certain cases where the female has a problem and the male doesn't have a problem, it's very important for the partner to relate to the problem. Otherwise, the lady is more stressed because there may be a familial pressure, peer pressure, friends talking about it, and hearing that, oh no, my friend just gave me a good news that I've conceived, and then she's been trying for over 1 year now. So these are psychological, distress, which cause more the hear, more the distress. So it's very important for the male to help the lady contract. So be very emotionally attached to understanding of the problem, and give her the confidence always that you are there with her, and you are sorting the problem together. Though she is the person who is undergoing, but you have to keep it very clear that you are both together in this whole journey of solving the problem.
Right, and because the child is going to be for both of you, right? It's your family. Wonderful. Thank you, doctor. This has been great conversation with you, and I hope the men who are seeing this will be able to get few tips out of it, and you'll start to get more comments around some resolutions. For anyone who wants to consult with Dr. Vasudha Sharma, She operates out of Bangalore and her clinic is in Kalyan Nagar and HSR layout. She's also available online for those of you who are not in Bangalore. For more content like this, keep watching, subscribing and sharing for more. Thank you.